So why didn't we know that estrogen affects our connective tissue, and why didn't we respect this sooner, especially for perimenopause and menopause, why they have tendinitis, widespread joint pain, stiffness? Why didn't we know? Well, let me give you some clues why we should have known. As you know, research is not based on women, it is based on men. They assume that women were the same as men. However, here are clues that we should have known that hormones change your connective tissue. Number one, young athletes, female athletes, are more likely to tear their ACL when they are post-ovulation. The average day of ovulation is 15 days, 15.5, so they're more likely to tear their ACL in the week before their period. Okay, number two, we know that your hormones have to change your cervix. We also know as pregnancy gets further along, we know that relaxin and all these other hormones change your tissues. We know that estrogen, progesterone, testosterone, relaxin, all these things change our tissues because it has to help us soften things so that a baby can slide out your pelvis. You also know when you're postpartum and still breastfeeding that you're very unstable. And I like to say that it's the garbage bag of bones phase. And this is where you're very unstable because your body's in this limbo phase where you're not the normal you, but you're not the pregnant you, but you're still postpartum breastfeeding, and it's a whole bundle of loosey-goosey. Then, as those hormones decline and you enter perimenopause, menopause, postmenopause, you become stiffer and stiffer and stiffer because estrogen helps us remodel. Estrogen helps us deal with inflammation. And we have estrogen receptors all over our body, not just in your breast tissue, not just in your vaginal tissue. We have estrogen receptors in our brain. We have stuff within our tendons and ligaments. And so our muscles grow with estrogen. Our tendons remodel with estrogen. Our bones need estrogen to maintain a healthy bone metabolism. And we're just now really talking about how it affects us through all our phases, specifically perimenopause, menopause, postmenopause, because we want to save the quality of life for you. But what you do have to do is you have to do lifestyle modifications. We have to change our habits because we're changing as humans. And I want you to know that it's not hopeless. There are things that you can do. And this is why I talk about your lifestyle. Like, I need you to do mobility. I need you to do strength training. I need you to walk. And all these are for a reason. Your mobility is to maintain the range of motion and to stress your ligaments in a proper way. Your strengthening is to help push up your muscle bulk since estrogen isn't pushing you up. Your walking is for blood flow to all body parts, pelvic floor, brain, but also great for your heart. And I need you to also know that that walking is really important for your bone density for the lower half of your body, where the weightlifting with the upper half of your body is really important for your bone density as well. Because the first things that you fracture are your little forearms, okay? And then I don't want you to fall, and then I don't want you to have issues with balance. And this is why talking about hormones, orthopedics, joints, your pain level is a really big deal.